Welcome to a new edition of Health and Wellness with Dr. Ed. I'm Dr. Edmund Sulkowski, and we have a wonderful show. I have a good friend that's coming on the show today to explain to you what to do about Medicare, about your retirement, and about annuities to help you with that retirement. Let's welcome Mr. Tom Yakopin from West Penn Life Health. Welcome back to the show, Tom. It's been a while since you've been on. I'm so happy that you took the time out of your busy schedule to come back and help educate us on what to do, first of all, when people come into that age that they're either retiring or getting on Medicare, and what that means to our daily lives.
Mm-hmm. Well, thanks for having me, by the way. It's always a pleasure.
My pleasure.
Yeah, I enjoy the time we spend together. And yeah, retirement and Medicare, I mean, we live in Western Pennsylvania where there's, a massive aging population and a lot of people migrating or aging into Medicare, hitting that golden number 65, right? Which is when most people age into Medicare, and it can be challenging. I don't know who came up with the rules to the road, but there are an awful lot of letters involved. Medicare A, Medicare B, C, the Medicare Advantage.
Well, my understanding, there's even a penalty if you don't apply for it within a certain time range. Yeah, which I don't understand either. What is that?
There are penalties, for example, assessed if you have a qualified entrance into Medicare or the Part D drug program and you choose not to, and then later need to sign up or choose to sign up, then they can assess a penalty for the rest of your life. It's pretty small, and that's probably the least challenging thing that people have to deal with. A lot of it is just understanding the rules to the road, figuring out what is best for them, and then kind of navigating the maze of various and sundry, supplemental insurance plans, all the media hype, Joe Namath on television advertising.
Oh, that's all you see are these Medicare advertisements if you watch TV. So you mentioned that magic age of 65.
Yes.
So you can't, my understanding is unless you have some type of medical disability or something like that, you're not eligible for Medicare until you're 65. But when should you begin to investigate that?
I recommend that anybody begin the process 3 months prior to turning 65.
So 3 months prior to your 65th birthday.
Makes a lot of sense, yeah.
And how do you go about doing that? Now, I know you can call up West Penn Life Health and speak to either Mr. Tom Yakopin or Janice or Jackie.
Mm-hmm. Or Shernice.
Or Shernice as well.
That's right.
And you can get some definitive answers on how to go about doing that. So you would make an appointment, and we'll talk a little bit later about how to go about doing that. But I think it's pretty important not to wait till the last minute to do that.
Oh, absolutely important, yeah. And of course, if people do call our office, we don't charge a fee for educating or consumer information. I've learned, and our agency prospers because our philosophy is, educate the consumer. Let's be problem solvers and trust that everything works out, for our good, and it does, for people. But the first thing that folks need to know is they need to sign up for Medicare. And Medicare Part A, which is typically funded through payroll taxes, it's already paid for, right?
So your working career has paid into that every pay period.
That's correct.
And your employer has paid into that for you for every pay period.
That is also correct.
So this is something that you get automatically, whether you need it or not.
Yeah. When you age in at 65, even if you're on a group plan, and there are, I was speaking with a gentleman earlier this week about a retirement annuity, and he is eligible and qualified for Medicare, but he is covered under a group employer plan because he chooses to work. He loves his job. and he has no intention right now of leaving that. So it isn't something that you have to exercise. It isn't something that you have to rely on. But very often, Medicare as an insurance program, people will find it to be a quality way of managing risk and accessing health care. And very affordable, I should add.
And we always talk about this when we are talking about health care. Health care is not health insurance. What Medicare is health insurance.
It is. Medicare is an insurance product. That's correct.
And this, you mentioned these alphabets, A, B, C, D. So what exactly is Medicare A plan?
Yeah, well, Medicare Part A is designed to cover hospital-related charges or costs. And when I say hospital related, I'm speaking specifically about inpatient, okay? Inpatient charges. So that's important to understand that Medicare Part A addresses the what can be very costly, right, and expensive procedures done overnight in the hospital.
So that's Part A plan.
That's correct.
And then there's the Part B plan.
Right. Medicare Part B, and anybody that has their handy-dandy red, white, and blue card that they get, there's an effective date on there, Medicare Part A, right? Medicare Part B is optional, but highly recommended because Medicare Part B addresses procedures, care, that is rendered on an outpatient basis. And if you think about how people access care today, I can't say a majority, but yeah, I would say a majority of the time, much of the care is rendered outpatient.
Well, I think there's almost a movement, you could call it, to keep people from being admitted into the hospital.
Yeah.
Even some procedures that used to be admitted for done as outpatients, and you're in and out in 4 hours, and you used to stay in the hospital for days after those procedures.
Yes.
So, and I assume that's to keep the cost of everything down, but this Part A and Part B, the biggest differentiation is Part A is in the hospital, Part B is outpatient. And that covers such things as blood work and testing and things like that?
It could be something as simple as preventative care is done outpatient, right? That could be a colonoscopy, a mammogram, things of that nature. It could be a simple office visit for cold or flu. It could be testing, therapy, x-rays, blood draws. It could be same-day surgery. All of that is outpatient.
So when you say that's an optional plan, there's a cost to it for you.
That is correct.
And Part A you do not have a cost for.
Right. Part A is typically funded, and for most Medicare-eligible citizens, it's going to have been paid for through their working lifetime, their payroll arrangement.
So this isn't relevant. I know you can draw a monthly income from Medicare.
Social Security.
That's Social Security, but isn't that all part of it?
Well, it's managed. It's managed by the federal government, yes. But to be sure, in fact, in the case, I just had the privilege of working with your sister this week, and she is signing up for Medicare benefits, but she is not drawing Social Security. So they are two distinctly different benefits managed through the Social Security Administration, but you can access and utilize Medicare benefits without drawing your Social Security retirement benefits.
But if you do draw, then they subtract it. They subtract the payments for like Part B from your Social Security.
It can be done that way, certainly. Yes. Mm-hmm.
That's not the standard then.
I think it is the standard if you are
drawing.
If you are. But again, there are a lot of people today, because of the choices and options as to when to activate your Social Security retirement benefits. A lot of people are choosing to wait to get a little higher payout on their retirement benefits, in which case they can just pay for Part B with a check.
So Part A, you're not going to pay for it. Part B, you're going to write a monthly check if you're not drawing from Social Security. If you're drawing from Social Security, they'll draw that part from your Social Security.
That is correct.
Okay, I thought there was some connection there.
Yep. And it's the same thing with if an individual chooses to hop into a Medicare Advantage plan, which is Medicare Part C, right? Any premium rendered to a commercial insurance company in that arrangement can also be deducted from their monthly Social Security payment if indeed the consumer is drawing their retirement benefits.
Okay, so now what is Plan C?
Right. Yeah. So you have hospitalization, right? Medicare Part A. That is part of original Medicare. You have outpatient, Part B, which is part of original Medicare. And I think it's prudent to say, to use a term such as original Medicare, because that's legal and it's accurate, and it is an apt description of Medicare Part A and B, meaning that that red, white, and blue card, that federal insurance program, really is Medicare Part A and B, right? Which is the meat and the potatoes of Medicare. Now, Medicare Part C, and this is all in the book that the consumer will get at or around age 65 from the government, a big red, white, and blue, kind of the Medicare Bible. I think it's titled "You and Medicare" or "Me and Medicare," and they go over Medicare A, B, C, and D. So C and D are actually relatively new on the scene. Medicare C is the Medicare Advantage option, which is what? And that is where to give consumers more choice. I think it was right around 2003, 2004, maybe 2005, 6, in that neck of the woods. There was a lot of talk about advancing a prescription drug program, which is Medicare Part D. But Medicare Part C is where private insurance companies, such as here in town, UPMC, many people have heard of UPMC for Life, or Highmark Blue Cross Blue Shield. There are many plans, Community Blue, things of that nature. These are all Medicare Part C or Medicare Advantage plans. And what a Medicare Advantage plan actually is when a commercial insurance company obtains a contract with the federal government through Centers for Medicare and Medicaid Services, CMS. And what they do is that they come under the scrutiny, of course, of government standards, actuarial standards, and agreements. And a private insurance company then, who must follow these standards, the standards are they have to pay no less than what original Medicare pays, Part A and B. So the minimum that a Medicare Advantage or Part C plan can do is match the actuarial payout of Medicare A and B, but they can do more, hence the name Medicare Advantage. And so these commercial insurance companies, oftentimes, what their bid is, we can provide the insurance protection, the insurance features and benefits for consumers better perhaps than original Medicare, and they get to compete to do so. So an individual who is aging in, we have some folks that want to stay in original Medicare, and I'll address some reasons why. And for many, it can be a prudent decision to stay in original Medicare. But a lot of people hop into Medicare Part C, the Medicare Advantage, because of its ease and simplicity. And it's true, in many cases, they get a little more, hence the advantage. So a Medicare Part C plan is a one card, easy access plan. Medicare A is covered there, Medicare B is covered there. Your prescription drugs typically are included in a Medicare Advantage, an MAPD plan. So they're very popular with consumers because they have their outpatient, they have their inpatient, They have their prescription all in one with a name that oftentimes they trust. Again, usually the major players, Aetna, Coventry, Highmark, UPMC. And then they also get some extras. What are those extras? Vision care, vision insurance. Typically, Medicare Advantage plans include coverage for frames, lenses, contacts. Another thing that consumers seem to like is dental insurance. Another is silver sneakers, or a wellness or fitness program where perhaps they can go down to the wellness,
a gym membership.
A gym membership, and these are all encouraged. And I think going back to something you and I talk a lot about is healthcare really begins in the kitchen, and it extends to, especially as we age, moving and staying fit. So any of these things, that encourage people to visit the gym, to walk, to swim, to lift some weights, good ideas. Excuse me. And they're all typically included in these Medicare Advantage plans. Now, some more, some less, again, depending on the carrier. But that's the Medicare Part C, the Medicare Advantage plan.
So to contrast the original with Part C, when Part C you sign up, let's just say Aetna, for example.
Right.
Do you have to stay with an Aetna providers?
Correct. Great question. The typical MAPD plan, Medicare Advantage plan, Part C, we're talking. One of the big distinctions between original Medicare and a Medicare Advantage plan is original Medicare, that red, white, and blue card, gives the Medicare eligible consumer access to any doctor, any hospital, anywhere in the United States of America with no networks, no PPO, no HMO, none of that.
If they're willing to accept Medicare,
well,
right?
They have to accept Medicare, right?
Okay.
Which, I think most doctors and hospitals, do accept Medicare. There's some that are opting out, but most do. So it is an advantage. Like when a consumer calls my office, I've trained my agents the same way that I think, and that is, I like to find out, I like to sit where the consumer's sitting and ask good questions. In other words, seek first to understand before seeking to be understood. And some of the things that I ask people is, especially, post-retirement, living in PA, because we have a lot of people that live here during the good days and then head south and they have a residence in Florida or...
So that's about 3 days a year.
Right, yeah, the good days. But you understand, so if you're a snowbird or if you are going to live somewhere else in the country part of the year, it may be very important to that consumer to maintain a freedom of choice health plan, which original Medicare gives them. A Medicare Advantage plan, typically it does a little more, right? It gives some advantages to the consumer. I call them goodies, right? The dental, the vision, the wellness, the this, that, the other thing. But there are some strings, and the commercial insurance companies, to manage their loss ratios, to manage their costs, these insurance companies have negotiated fees with their various and sundry providers, their preferred providers, hence the term PPO or HMO, in which case you have to go.
So you want to look, first of all, to see if the physician you're comfortable with or the dentist you're comfortable with is in their network.
That's correct. It's very important.
And then you can choose a plan accordingly.
That's correct.
Okay, so what happens, Tom, if you're on this, again, with Aetna, which is PPO?
Aetna has PPO or HMO.
Okay, which is better?
Well, I tend to avoid questions like better or best or worst because it's really all preference. If your doctors and hospitals are in network, then it really doesn't matter. You're not going to know the difference between an HMO and a PPO. An HMO is stricter in that there is no coverage out of network unless it's emergent, okay?
Okay, so let's say you were in California.
Yeah, you're traveling in California, you have a heart attack, you go to the hospital with an HMO, you're fine, you're covered.
Okay.
But if you are traveling to California and you decide to get a non-emergent procedure, an elective procedure, and it's out of network, you have no coverage. You're going to write a check for that. A PPO plan encourages you to stay in network. They incentivize you to stay in network. Lower copays, lower out of pocket. You can go out of network, however, and still get care, but you're going to be penalized, typically at or about 20%, perhaps a little more, and a maximum out of pocket, a higher maximum out of pocket for the year. But a PPO plan does give the consumer coverage or protection in and out of network.
So if you're someone that travels a lot, that's an important factor.
It is, yeah. And it's important when you're aging into Medicare to make sure that these questions and answers, are discussed with whatever advisor you're working with.
And that's why you don't want to discuss this over their phone with some national advertising.
I agree. Yeah, I agree.
You need somebody personal, like somebody from West Penn Life Health that actually can sit down and spend an hour and a half with you going over everything, which I know exactly what you do.
Yeah, it is what we do. I like to say this. We tend to advise or build these plans, recommend plans from the ground up. It's not about the logo or the label or the name. We look at a person's habits, how they access health care, where are they going to live, do they see themselves getting their care primarily here in the tri-state? We also look at doctors and hospitals. Who do you use? Who do you see yourself using in the future? How important is it to you to have freedom of choice? And we make recommendations on that. And then we also, very, very important, we look at people's prescription drug utilization. So before we make a recommendation about what plan or any plan somebody should choose, these are things that I want to know about a consumer so that they can live with the decision that we help them with, and we feel good about it too, because we're going to see them in the community, and we want them. We like happy customers.
Well, I know 5 years ago I came knocking on your door, and my health insurance, which I've paid privately my whole life, was going through the roof. It was a mortgage payment, if not more. And we sat down, and you gave me very effective coverage for, I don't know, a third?
About a third, yeah.
Yeah. It was absolutely amazing.
Yep.
And you spent that time with me. I think the first meeting was probably at least an hour and a half.
It was.
And you asked me to bring certain things in with me, and we sat down and went over and said, this is probably what will be your benefit. Mm-hmm. And it was.
Yeah.
So what's lacking, in my opinion, almost everywhere these days is customer service. That doesn't lack at your facility.
It doesn't. No. I believe in high tech, and I embrace it, and we use it. We do Zoom meetings and all of that. But I think there is and always will be a place for high touch, and high touch is personal service, man. We have a brick and mortar building at 1100 Washington Road. People can drive in, they can walk in, they can sit in a conference room, talk with myself, talk with one of our licensed agents. Not that that's imperative, and I think more and more people and more older citizens are embracing technology as well, especially through the pandemic. In some cases, that was 80% of our consultations, although we've been visiting with people throughout, okay? But high touch, man, I'm a biggie on personal service, relationships,
Absolutely.
And trust, yeah.
So if I was a snowbirder, and I spent half of my time in this area and the other half of the time down in Florida, for example, I better really be looking at my plan to make sure that I have the proper coverage for those 6 months here and 6 months down there.
No doubt, yeah. Or you could run into a few hiccups. No doubt about it, yeah.
And your idea is to stay well, but things are going to happen.
Yes.
And especially as you get older, things are going to happen. I mean, just falls tend to happen a lot more.
No one gets out of here alive.
Yeah,
right?
That's right. Nobody does.
Yeah, injuries and illnesses are going to happen to all of us.
So you really need to make sure you have the coverage. Are there different rules regarding each state?
There are, and again, that's a major concern, especially if you're going to get into some type of managed care plan, which would be the Medicare Advantage Part C. Usually, not always, but usually people who are in that situation where they are snowbirds or living here some of the time and in another state, usually I'm going to recommend as much as possible that they stay in original Medicare, potentially buy a Medicare supplement. And keep in mind, original Medicare doesn't need you don't need any additives to use original Medicare. And by itself, it isn't bad, okay? But on the outpatient side in particular, because it's an 80-20 cost sharing split, a small deductible per person per year, and then an 80-20 split, that 20% is not capped. So the bigger the bill outpatient, the more the consumer pays, and there's a lot of costly items outpatient. So typically, if somebody's in that scenario, I'm going to strongly recommend staying in original Medicare, potentially get a good Medicare supplement, and then a Part D drug card if they feel that that's important and necessary as part of their well-balanced risk management strategy. And what that gives the consumer is the freedom of choice to seek care anywhere in the United States, here, Florida, Arizona, Maine, Texas, whatever you want, any doc, any hospital that accepts Medicare, no hiccups, no networks to worry about, you know.
So Part D is the strictly drugs.
Part D is the prescription drug program. That is correct. And that is a federal a federal program, but it is administered and paid for through commercial insurance companies. In other words, it's not part of original Medicare. It's not part of that red, white, and blue card. To have prescription drug coverage, you're going to need to enroll in a Part D drug plan that is, administered through a private insurance company, a commercial insurance company, like Silver Scripts, Aetna, Highmark. They all have them.
And that's an actuary list of drugs.
Formulary, yeah.
Formulary, that's the word I'm looking for, yeah. So that doesn't mean every drug is covered.
No, but they do have to cover, and part of their agreement is to cover every category of drugs. And that's also important when we sit down with a consumer. Now, again, not everybody 65 and older is using a lot of prescriptions, but we have some, clients when, we ask them to bring their prescription list with them. They roll it out and it looks like a scroll, so we're going to look at that very carefully and make sure whatever recommendation we make or whatever choice they make, that we have a computer program to give them to the penny what those costs are going to be with any number of healthcare plans available.
So we mentioned A, B, C, and D. Is there an E and F?
Well, there is an A through J when you get over into Medicare supplement.
This is like the alphabet soup
That's what
of
I'm
Medicare.
saying. Yeah, I don't know who came up with the idea. Let's just overwhelm people with letters and numbers, but Medicare's rife with that. Yeah.
So you need somebody like Tom, Shanice, or Jackie to really explain that to you.
I would say we provide a valuable service.
You're not going to get it from a commercial and a 10-minute phone call to sign you up. Yeah, so important. Tom, we're going to take a little break here. We're going to be back. And I'd like to move from Medicare and talk about retirement.
Absolutely.
Because they kind of go hand in hand.
They do.
We'll be back at Health and Wellness with Dr. Ed with Mr. Tom Yakopin from West Penn Life and Health. Back to Health and Wellness with Dr. Ed. I'm Dr. Edmund Sulkowski, and we're here with Mr. Tom Yakopin from West Penn Life and Health. We were talking about Medicare, which, that's health insurance. We all need health insurance. Some of us have illnesses. There's always that slip and fall. We always have to be protected with health insurance. But we're going to move on to another topic that's somewhat related, and that's retirement, because when you retire, you need that health insurance because you're going to lose yours. So Tom is going to talk to us about what the process is when we leave a job that provides us with a bunch of things such as health insurance, such as life insurance and so forth, and how we move from working to a non-working environment.
Yeah.
So what does retirement actually mean? I'm sure it means a lot of different things to a lot of different people.
Yeah, well, we get a lot of calls, right? A lot of my friends are in that category right now. Oddly enough, I never thought I'd see the day, but I have a lot of friends retiring. They leave their work. They'll call the office, or of course, we're on radio all the time. People hear our ads,
That's Health and Wellness with Dr. Ed.
Yeah.
Tom is a sponsor, and he's always on the radio show as well. So you can get a lot from that every Saturday morning at 9 o'clock. How about that plug?
Thank you.
12:50 a.m. The Answer.
Thanks for having me. Somebody calls the office. Hey, I'm retiring. I heard you guys can help us with that. We'd like to set up an appointment. Super. And usually what I see in that scenario is, a classic example might be Joe Blotz, Sally Doe, whatever. Joe's retiring. He's aging into Medicare. He's 65. So much like we talked about in the first half of the show, we're going to help him or her navigate the Medicare maze, right? If Joe Blotz is married, there's a high probability, if he's married, that his spouse, or if she's married, that her spouse might need either the same Medicare benefits, or if the spouse is younger than the Medicare eligible retiree, maybe they need underage health insurance.
Because they're often covered by the policies of the employer.
Yeah, they're on their spouse's group plan.
Yeah.
So we address that. So very often the first thing we talk with consumers about is helping them navigate the Medicare maze. And then if one of if their mate needs underage health insurance, then we help them navigate that, right? Either with an ACA plan or any of our private health plans that are non-ACA, medically underwritten, that perhaps save the consumer. And by the way, we sell a lot of non-ACA plans to individuals who want to save money, maybe 20 to 50% over the traditional comprehensive major medical insurance. But we'll look at everything. If they're getting subsidies, maybe an ACA plan is best for them. If not, maybe a non-ACA plan. So again, we help the consumer with Medicare if that's necessary, and typically it is. We help the spouse with underage 65 health benefits if necessary. But other things that we're going to address in that initial meeting, that fact-finding meeting, is what else, what other benefits did you enjoy as an employee of said group or union or whatever they're a part of? Did you have dental insurance? Yes or no? Is that something you want to keep going forward? Yes or no? Did you have group life insurance? Something that that's interesting, right, is that very often people enjoy life insurance as part of their group benefits. But what I find is very often that group life insurance either ends when their employment arrangement ends, or it begins to step down radically. So that's something that should be discussed. Not everybody needs life insurance in their retirement years, right? Depending on how much money they've saved, how much debt they have. Do they want to, leave something income tax free to their loved ones or not? But it's certainly something that should be discussed, life insurance. It's something we help people with.
And, you mentioned dental insurance, and all health starts in the mouth. And I've seen this happen because some people have lost their jobs and they're coming to the office and they haven't been there for a while. And they'll say, why haven't you been here? Well, I lost my dental insurance.
Wow.
And so then they tend to neglect, and now they're going to pay more now because they've gotten into trouble and they have issues. So, getting dental insurance is just as critical as having overall general health insurance.
Yeah. Your oral health affects your overall health. We know that to be true.
Right to the heart, right to the kidneys, right to the liver. Anything that's going on in your mouth goes right in the bloodstream.
Yep.
So it's so critical, but it's not talked about enough. Maybe I got to focus a little more on that. But that dental part is extremely important because things are expensive these days.
Yeah, they are.
Yeah.
Yep. And I think it's a travesty as well that that people aren't seeking care because they don't have insurance, which goes back to dental care and dental insurance are two different things. So it's important that people stay regular and routine with their oral maintenance,
Absolutely.
whether they're insured or not. But certainly having a good dental plan can offset those costs. For example, a standalone dental plan that we sell a lot, and it's $18.70 a month for an individual. It'll pay up to $1,500 per person per year. Covers preventative and full mouth X-ray, 100% no waiting period, small copay, $25 copay, and then it kicks in and begins to cover basic and extractions, and then even major work after 1 year. So there's no reason for people to neglect that, and that's something we can visit with people on.
You know, I say this all the time. You should never determine your health care and your protocols based on your health insurance.
Thank you.
You know, and I don't know how that happened. The healthcare system dictates, the insurance companies actually dictate medical care. I mean, it's so bizarre, Tom. So if somebody has a gum issue, gum disease, and there's procedures we do. So, you know, you have your standard cleaning, but we have something called a debridement, and then there's a subscale which goes way down deep into the pockets and so forth and cleans all that up so that you get rid of that culture that's growing underneath the gums, going right into the bloodstream. So if you come into the office and you have these insurance plans, and I do a comprehensive exam, and I say, well, you need a debridement. I can't do the debridement. My office cannot do the debridement the day that I've diagnosed you.
Wow.
I have to send you out and bring you back another day. And then I can't do I could technically do the debridement and a subscale on the same day, but I can't do that. I have to send you back and bring you back another day. That's healthcare. That's health insurance dictating healthcare.
Yeah. And it's a travesty. It hasn't always been that way. And as you know, I mean, while we do help people with managed care plans, I'm not a huge fan of what I call the unholy relationship between commercial insurance companies and caregivers, you know, because it is something that I've seen in my career growing more and more, where insurance companies are dictating care. In fact, I mean, we have insurance companies that own hospitals and doctors,
Yep.
You know, and are calling the shots. I mean, it's not the best. And I'm a fan. I know I think you've had my friend and Dr. Rebecca Plute, she's
been on the radio show, she's been on the TV show.
And I'm a huge advocate of direct primary care. I'm a huge advocate of the Free Market Medical Association, who I speak very positively about, because they're pushing back against that relationship, by the way. But,
yeah, she's a patient of mine, and I'm a patient of hers.
Yeah,
so
lovely human being.
Absolutely, her whole family. But getting back to that, you know, you can't let insurance dictate. You need it to help you, but you got to be careful the plan you pick so that they're not dictating.
Right on. Yeah.
And you know, my eyes are extremely important to me. They're just, you know, as important as my fingers or my teeth. So I go twice a year for an eye exam, but my insurance covers only once a year, right? Mm-hmm. So I make an appointment. They'll say, well, you know, your insurance is going to not cover it. Fine with me.
Right on.
You know, I need my eyes, and I need to make sure everything's okay with them. If I'm paying out of pocket for them, fine. You know, so don't think that you should allow an insurance company to dictate your health care.
I couldn't agree more. Yeah, we only have one body, right? And you know, I think about how I treat, you know, my house or my cars or my Harley, you know, and I take very good care of it. And I change the oil, and I actually don't have any insurance coverage on an oil change or routine maintenance. It's just good business to take care of something that's of value, and your body is incredibly valuable, right? And the care of your health is incredibly valuable, whether it's choosing the right foods, whether it's drinking the right substances or not drinking certain substances, or limiting, you know, as Dr. Plute says, Tom, remember, it's a glass of wine, not a bottle, right? Yeah, because I do like my wine, you know, But, you know, with retirement, again, these are conversations that we have with people. As we said on the first half of the show, we want to make sure people are in a scenario that they have a risk management strategy, which is really what insurance is. Insurance isn't the care. The care is your decisions. The care is your relationship with your primary caregiver. That's the care. We're just putting mechanisms in place for the consumer to help them offset those costs, the cost of a catastrophic loss, the cost of major oral issues, and so on and so forth. So that's what insurance does. Life insurance, interesting thing about life insurance, I call it love insurance, okay? Life insurance is probably the only insurance that I can look a client in the eye and say, look, if you have a permanent life plan, I can guarantee you're going to use this. Why? Because none of us gets out of here alive. Yeah. We're all going to die. You may never total your car. Your house may never burn down, and yet we have insurance on all of these things. And I'm a big believer in life insurance, okay, for many reasons. I have 4 grown children. I now have 3 grandchildren with one of my daughters. My son's getting married in Nashville this December. My youngest daughter's getting married the following year, so hopefully more grandkids on the way. And life insurance is a powerful instrument. It serves a lot of, it can solve a lot of problems in that with a life insurance contract in place, you have an immediate income tax-free estate. Meaning what? Meaning the day that I die, probably the first money that's going to hit any of my children's hands is a life insurance proceed. And that will bypass probate. That's outside of any estate planning I do with my attorneys. That goes direct to our beneficiary, to your beneficiary, and it is income tax free.
So they just get it.
They just get it. They can take it to the bank. They don't have to report it on their taxes, and it can be a lot of money. I mean, back in the day, I think people were more savvy and purchased more life insurance than they are purchasing today. And I see a trend in our society where people tend to be more debt-ridden and have less assets, right? The old timers. You and I had a mutual friend in Frank DeZomba. Frank was old school. And Frank was a great saver. He accumulated some wealth over his lifetime, and he lived a very modest lifestyle, okay? And that was common with the old timers, right? And I think it's a trend that we should be embracing and teaching our young people about is, solid financial planning, saving, and life insurance. And I'm still a big believer in cash value life insurance. It's not very sexy, but it is a great product where the premiums never go up, the benefits never go down, and it accumulates cash value that can grow, and in some cases, if it's a participating whole life plan, dividends can be earned. You can borrow against that equity. It's a great financial tool that I think people should have. Now, if somebody comes to our office and as part of their retirement strategy, they say, look, I have debt, I'm debt-free or very nominal debts, and I've got plenty of money in the bank, CDs, stocks, bonds, mutual funds. We're not going to push life insurance on them. But it's certainly something people should think about. And it's certainly something that young people who have mortgages, children, et cetera, should have.
And rates are based on age.
Correct.
Health as well?
Age, health, gender, and tobacco utilization. Men tend to die earlier than women. That's just a mortality statistic, and insurance, whether it's health insurance or life insurance, is based on either morbidity, that's sickness, that's how you price a health insurance product. Mortality is how you price a life insurance product. So the law of large numbers is something that an actuarial scientist looks at. In other words, if you study enough numbers, you can estimate almost with absolute precision when the average male in America dies, and the same with females. And so it's based on that mortality table that is an accepted standard, an actuarial standard by the commissioners in the insurance business in each state.
So the earlier you get health insurance, life insurance, the better off you are.
Absolutely, yeah.
What's too early to get life insurance?
Well, I'm not a big believer in buying it for kids necessarily, although we sell child policies. But I would say, You know, when you start working for yourself and you start taking on debt, or you're responsible for others, which takes me back to why do I call life insurance love insurance? Well, because it's a very unselfish thing. You're taking a little bit of money today and you're buying a product that, for example, when I was a father with 4 children at home, you know, working, they were all dependent upon my income, right? And if I were taken out of the picture suddenly for whatever reason, accident, injury, serious illness, that would disrupt their income. That would disrupt their lifestyle, you know, your spouse, their ability to function. So I would say when you start taking on responsibility, you buy a house, you want to make sure that if you die, if you're the breadwinner, if you're paying that mortgage, that mortgage is covered, that those kids, your wife, whatever, your husband, are taken care of. If you own a business, sometimes we sell life insurance, you know, on business partners, a funded buy-sell agreement, right? Or a key person life insurance product. What's that? Somebody that's very important to an organization. You know, if you have a key person in a business and he or she dies, that business is, you know, going to suffer some disruption. Well, a life insurance policy paid for by the business, perhaps owned by the business, on that key person, and the business is the beneficiary. If that person dies, now that business may have the money to overcome the loss of productivity that key person granted, and maybe even now reach out and attract new talent to replace it. So life insurance, estate planning, there's a lot, especially now. I have a hunch in the years to come, we're going to see escalating inheritance taxes and estate taxes in the future. We do, you know, life insurance is a great product to pay for those taxes. Let's say somebody owns a farm with a gas well on it or something, you know, and it's worth a lot of money. You know, they want to make sure that their property that they've built, or their business that they've built, or their gas wells, or whatever, their royalties, that the kids inherit it, that they don't wind up giving 2/3 of it in taxes back to the government. So life insurance is quite an interesting product. And at the very least, some people, when they retire, Ed, use it to make sure that their funeral, burial, and final expenses are paid for.
Which are extremely expensive these days.
Unfortunately, it's true. So that's, you know, that's it. And those are discussions we typically have: Medicare, underage health, life insurance, dental. And then another topic that I wanted to talk with you about today, and that's our safe money annuities. In topsy-turvy times like this, you know, and again, I like to putz around with the stock market. I have my little Fidelity account on the phone, and, you know, and I have some wins and I have some losses, of course. But the challenge, the older we get, and this is what I say to people that ask me for help with retirement, the older you get, the less time you have to overcome market corrections. Right. So very often part of our strategy with working with a consumer in retirement is addressing, what do I do with my 401k? And we often help people roll over their 401k to a safe money annuity.
So when you use that term rollover, that's avoiding tax complications. Is that what that does?
Yeah. So a 401k is a tax qualified product. Typically it's funded with pre-tax dollars. So it has to be rolled over into a like account, a qualified account. And so a safe money annuity can be set up either qualified or non-qualified, meaning, you know, somebody has money in a CD at the bank that's underperforming. They call us up and say, hey, I heard you're running an ad. Put your money to work for us. We can earn 4.5%, for example. We have a safe money annuity right now paying 4.5% guaranteed for the first year. And so we have people calling, you know, I have $100,000 in a CD at the bank. It's not doing anything. We can move that from the CD in the bank to a safe money annuity. It's a simple transfer. It's non-qualified there, non-qualified here. They have access to their interest after 30 days, etc. We do the same thing with retirement planning with a 401k. It's qualified money, so we do an internal transfer, right? Simple docs. They move that money over to the Safe Money Annuity. It's a personal IRA. It is qualified. It's a non-taxable event.
Explain qualified and non-qualified.
Yeah, qualified simply means, qualified can apply in the health insurance arena. For example, the federal government considers an ACA plan a qualified health plan, right? So typically, fundamentally, and it's the same thing with retirement products, an IRA is actually tax deductible because the government says so, right? It's a law in the tax code that if you open up a qualified individual retirement account, your deductions, your deposits, within certain parameters, based on your age, your income, things of that nature, they are tax deductible. In my case, I use an SEP, a simplified employee pension. I'm self-employed. So that's a qualified plan, and I'm able to tax deduct monies that I put into my SEP, and that benefits me in my working years where my income presumably is going to be higher than in my retirement years, right? Yeah. And so the government is saying, we're giving you permission to tax deduct this, but you got to play by our rules. And that's typically, what you find with any qualified product. There are rules to the road established in our tax code and set forth by the United States government. Okay? So the Safe Money Annuity is a great product for retirees. Why? Because it gives them predictability, it gives them safety, it gives them access, and it only goes up. I like simple, I have to admit, and one thing I like about a Safe Money Annuity is it has very strong guarantees. It has a declared current interest rate, as I said, on our Platinum 8. 4.5% is very good today. It also has a guaranteed minimum, meaning what? Meaning for the life of the contract, you're never going to earn less than 2%. And I'll be honest with you, 2% is actually attractive today. You're not going to find 2% on a savings account or a CD in many banks, right?
No, not at all.
So you have parameters. So a consumer that doesn't want to risk their nest egg with a volatile stock market, which can go up, and the stock market historically does go up, and it's been a winner for many people. But it also, these market corrections can really ruin somebody, and if you don't have the time to overcome that, for example, I've talked with people who have gambled with their retirement nest egg and lost. And in some cases, it significantly impacts the rest of their life, where now instead of enjoying, a monthly income from their nest egg, they're working part-time as a greeter at Walmart to make up for the, $500,000 they lost in the stock market or something. So a Safe Money Annuity is just a wonderful product. It can be a super alternative to bank CDs. There are a lot of people that have used bank CDs, and they use the interest to subsidize their retirement. And they don't have that anymore. Well, they can move that money to a Safe Money Annuity. For example, on $100,000 at 4.5%, that's $4,500 in income that you have access to just by moving your money. And then if they roll over their retirement in a Safe Money Annuity, they know it's going to be safe. They know it's going to grow. There are access privileges to use that money. And then if they want to, they can even annuitize that product, meaning we can guarantee a monthly income for the rest of their life that'll never go up, never go down, just like the old-fashioned pensions that many Americans enjoyed, not unlike my dad, who worked for the U.S. Bureau of Mines and then Energy Research with the federal government. When he retired, he was guaranteed a pension. And then when he died, my mother received the lion's share of that amount for the rest of her life. That is something else we can do with a Safe Money Annuity is, the person can keep that money intact, just like it is now, perhaps with their current trustee of their 401k, or at any time in the future, if they wish, they can annuitize that product and move it into a guaranteed lifetime income. And for some people, that's what they're looking for. It helps them plan and budget, et cetera, et cetera. So those are the things that typically we talk to people about. when they call West Penn Life and Health and say, I'm retiring, I need help. Medicare is a biggie, navigating that maze with all the letters and, nomenclature and all of that. Underage health insurance if they have a spouse, life insurance, dental, supplemental benefits that they may have had that they want to keep. And then, of course, what do I do with my 401k?
So you could actually, almost sounds like one-stop shopping at West Penn Life and Health, Tom. So do you have different departments that different people handle all of this? Or?
Well, yes. For example, Janice Steed, she's been with me now as a licensed agent going on 8 years, okay? And little by little, Janice used to be a data entry clerk with our company, right? And she got her license and little by little learned first health insurance, then Medicare, then life, and now annuities. She can speak all of this fluently. Shernice Wilson's been with me 3 years. She was an editor for 2 large television programs.
She's been there 3 years already.
Yeah, 3 years. She edited the news in a major channel in Pittsburgh, and then Cincinnati, got out of that business. We've been friends for years, and she can speak health insurance now. She can speak Medicare. She can speak life insurance, and she's learning annuities.
And she's getting it done. I know a number of people that I've talked to said that they called Shernice, and
she's a pro, man.
Done like that.
Both of these girls know what they're doing, but it takes time. I mentor our agents, and I work very closely with them. Oftentimes I have them sit in with me if the consumer permits to just watch how I interact with people and learn, because it helps me immensely, and it helps me expand my footprint and do other things as well.
And you make yourself available, I know, when you can as well.
Absolutely.
So, Tom, give us some contact information. I know it's going to be on the screen.
Sure, absolutely. So our office, as you know, is 1100 Washington Road, Washington, Pennsylvania, right on Route 19, just up the hill from the Meadows, from Steel City Harley. We're right next to Park Place Realty, my friend Barry Crumrine right there. If you need to buy a house, go see Barry. Or you can find us on the web. Our digital office, right, is westpennlife.com. We have a very nice website there with a lot of information. They can reach out. They can request information. They can schedule an appointment with our online calendar at westpennlife.com. They can call the office at 724-228-7187 and schedule an appointment over the phone, or they can just walk in, 9 to 5, Monday through Friday.
And you can hear Tom's commercial on Health and Wellness with Dr. Ed Radio every Saturday morning at 9 o'clock on AM 1250 The Answer from 9 to 10.
There you go.
And Tom is often on the show. Thank you, Tom, so much for coming on.
Thanks for
a lot of information.
Yep.
Lot to wrap your head around there.
It is.
Remember, a healthy pet is a happy pet. When you're healthy, you're happy as well. And remember, AM 1250 The Answer every Saturday morning. God bless. We'll talk to you next time.
Bye for now.